It was about 15 or 20 years ago that I was doing an evaluation interview of a woman. It was unusual, but not bizarre. In fact, I would have to say it was completely normal, except for one thing. When she sat down, she said about herself that she was a borderline personality disorder, and, in response to my questioning, that she had been raised in a very normal family and that any personality traits she displayed that were pathological were all on her own. She described no personal history that would have supported any symptoms or unusual behaviors. In fact, her behavior was entirely normal throughout the interview, and she gave as clear an answer to all of my questions as anyone possibly could have. I should add, and I may have even said in the past in a previous episode, that when I was doing an assessment for disability, I had no idea what the criteria were. All I knew was what a complete report looked like to me, and that's what I did. She answered all the questions normally, did not behave out of the ordinary, and there was nothing that would have indicated to me that she might have suffered from a borderline personality. And when you're writing a report, you base it on your observations and the answers to the questions that you ask of the claimant. I don't know how I finally diagnosed her in my report, but lacking for any symptoms that would have indicated a mental disorder, I probably said there was no diagnosis, which put her within a large group of people that lacked for any diagnosis and that were ineligible for disability benefits. Truth is, I don't even remember whether I said anything about borderline personality at all, and I might not have because it wasn't relevant to what I was observing. Chalk that up to an unusual experience that was not unusual in any way, and that's what made it unusual. And then there was my older brother, probably the first person that I attempted to diagnose when I was first learning the diagnostic criteria in the DSM. That is, the Diagnostic and Statistical Manual of Mental Disorders. He was among the first people that I tried to get as far away from as soon as I was mature enough to find my own path in life and in the world. He was not a nice person and, as I can attest, was only happy when he was doing things to upset and make people's lives miserable. I later found out that in addition to antisocial personality disorder, he had been diagnosed as suffering from bipolar disorder. Although I would venture a guess, even though I was not there, that the psychiatrist who diagnosed him with bipolar and probably even provided medication prescription assumed that his out-of-control behavior was due to the fact that he suffered from bipolar rather than thinking that he really just enjoyed engaging in antisocial behaviors that made everybody's life difficult. After all, he attempted to smother me twice when I was about 3 years old, when he had me alone without our mother's supervision. This is where I learned, although not a yogi, how to control my own breath sufficiently that he didn't know I was breathing anymore, even though I was beneath the pillow that he had smashed into the back of my head. And now I know, perhaps the psychiatrist knew at the time, that he could suffer from both bipolar disorder and also antisocial personality disorder, the latter of which involves rule breaking and engaging in criminal behavior. I know that was the kind of behavior that made him the happiest, and he took it out on everybody. He even took the money that he earned from his newspaper route to purchase a brand new shiny Bowie knife that he intended to use to kill our father. My mother found it in time, and before my father returned from his professional travels, that in the end there was nothing serious to be done about it. My father refused to have my brother sent off for mental health treatment, which is probably what should have happened, but instead we just continued life as we did before, with perhaps my father sustaining a sprained wrist from punching my brother in the arm, and I think that was about it. But this episode isn't about the kinds of significant events that mold one's life, and it certainly isn't about me trying to complain about my childhood, which in the end left me with a wealth of useful experience for my future profession. Rather, it is to ask the question, where do these kinds of pathologies come from? What is their origin, and how may we begin to understand them? And it is from these little vignettes, stories of my life and what I am able to reveal from some of the cases that I have experienced over the years, that I have to conclude that not all personality disorders, in fact, not all pathology, can be traced back to a person's individual history. Rather, there is something else that might drive it. And so we have the tale of the snake and the cortex. The cortex also being known as the bark, as in tree bark. The two cases that I just described, including the one about my brother, have a single thing in common. That is that no one knows the source of why the pathology existed. I had a colleague tell me that the reason for my brother's antisocial behavior had to have something to do with his upbringing, and he resorted to citing Albert Bandura's theory of social learning. Although, as I informed my colleague, there was no reason to expect that his behaviors had anything to do with prior abuse. He was simply inventing it on his own. My colleague doubted it, but as I informed him, and I know my colleague refused to accept the fact that I was there almost the entire time. And more than that, we were pretty much a family that was raised by our mother because our father was so frequently gone. And this was a woman whom I had known not to have engaged in any violence ever, or to get so angry as to take it out on another human being, not even her son. So we have personality disorders that in essence just fly in out of the window as if they came spontaneously. How is this possible? Indeed, that's one of the reasons that I am engaging in this podcast, to discuss the very issues that I find the most challenging, and also to try to understand how it is that certain things that you can do to intervene in a person's life when you're doing therapy can be successful in certain cases and not in others. What is it that sets different people apart? Not only their diagnosis, but how you treat them. So inevitably, I go back to the snake as I previously described it. And I am now also integrating the notion of the cortex, the cerebral cortex, or the bark, that is the source of most of our cognition and the largest part of our brain. And in entering this discussion, it is probably worthwhile to reveal that diagnostically, and I think from the point of view of most of those mental health professionals in the area that I previously practiced, don't really separate the influence of the cortex from the limbic system when they engage in diagnostics or when they try to do therapy with someone who has significant mental health problems. The reason is, at the most fundamental, is that's the way we are taught. We are taught to deal with an integrated person, a person who's a single individual presenting themselves to us, asking us to help them with whatever problem they perceive themselves to have. But what we are not taught to do is how to engage the unconscious, the snake, how to engage it and involve it in therapy, or to understand even how it participates in human thought. Except for how the snake reveals itself in our dreams, or in episodes where we are not acting consciously and end up doing things that may be against our best interests. The diagnostic manual does not fully address it, or really hardly addresses it at all. Rather, what it does is look at symptoms in order to arrive at a diagnosis that may be addressed through the use of medications in order to minimize those symptoms and allow a person to operate normally. Unfortunately, That doesn't happen anywhere near as often as one would hope or expect. And part of the problem seems to be that our notion of personality, how personality functions in individuals, is fairly fixed, although it is incredibly poorly defined. In essence, nobody really knows what it is, not even the experts. What is a personality, after all? I will say, from the DSM-3, the earliest version of the diagnostic manual that addresses personality directly and at all, it describes personality traits as enduring patterns of perceiving, relating to, and thinking about the environment and oneself, and are exhibited in a wide range of important social and personal contexts. But what it doesn't do is define what a personality is, leaving us with the question of, what is our personality? We know that we all have one, but what in blazes is it? So I go to the work of Theodore Milan, who was the expert, after all, of personality disorders. He is the one who created the standardized test to assess personality disorders, and he, in essence, defined the entire concept in full. But what he does not do is say what a personality is. In his own work, Disorders of Personality, DSM-4 and Beyond, Theodore Milan makes reference to Gordon Allport for the definition of personality. And he quotes Professor Allport, 1937. The term personality is a perilous one for the psychologist to use unless he is aware of its many meanings. Since it is remarkably elastic, its use in any context seldom is challenged. Books and periodicals carry it in their titles for no apparent reason other than cadence. This quote of Professor Allport is from Professor Milan, that is, a expert quoting an expert on something that can't be defined. Despite this, the DSM-5 provides elements of personality functioning, and there are 4 total: 2 for the self, which it says is identity, experience of oneself as unique, with clear boundaries between self and others. The second trait of self, as described in the DSM-5, is self-direction, pursuit of coherent and meaningful short-term and life goals. Interpersonally, it describes empathy and intimacy, attributing it to the individual personality as it interacts with others. That's great. We all have a personality, but how did we get here? Why is it that we are individuals with capacity for intimacy and empathy? And why should we even bother? Theodore Milan developed his standardized measure to determine who has what kinds of personality disorders, and yet he can't get past the initial definition of what a personality is. He can merely describe the symptoms of when a personality does not function properly. And we also know very well that a lot of the medications prescribed for mental disorders don't have any significant effect on sufferers of personality disorders. So let us say, as common users of psychology, we all intuitively know what personality is because we all have one and are very protective of it for the most part. But from a clinical point of view, the only way that personality can be directly addressed is when there are disorders that interfere with its functioning and that make it difficult for others around the personality disorder to function with that person. So what we have here is a direct separation between how a person feels about him or herself and how clinically psychologists or mental health professionals think about them. We think about ourselves as normal, at least normal for us, however abnormal we may actually be. But mental health professionals inevitably are always looking for what's wrong and describe what's wrong in terms of symptomology. The only way for the two to meet is if somehow the practitioner can come to terms with who the person is sitting in front of them, who may be very protective of their personal experience and who they think they are as a person. So I am positing here that what we know as personality is really a product of the limbic system at its earliest point in time. Maybe Copilot doesn't want to ruffle my feathers when it gives me the answers to the questions I ask about our brain and personality. And maybe it wants to assure me that what I am thinking is egosyntonic, that is, that my thoughts are consistent with who I am and the hypothesis I am proposing here. In any case, let me say in advance, I am soothed by its response. And it tells me, consistent with what I have long believed, the snake, that is, the limbic system's thoughts and development, are the first to emerge in a human being. The limbic system, as it reminds, is consistent with the amygdala, hypothalamus, and hippocampal scaffolding, all those structures that are primary to our experience. And our cognitive development progresses from there. That is, it is highly reactive and is reactive to all of those stimuli that occur in the environment when we are extremely young, even as infants. And as it describes, it responds to threat, stress, and emotional imprinting as part of our earliest development. Now, what I am proposing is this is the earliest form of personality that we have, and it is the basis on which we become who we are going to be. It is that thing that we need most to protect at our earliest time of life, and it follows us throughout the duration of our experience. It is the very foundation that we build on through all subsequent actions and subsequent experiences. But the thing about this, as we discuss psychopathology, and really at its very foundation, we have to recognize that psychological diagnosis, as it currently exists and has existed in the past, is prompted by an analysis created by the gray matter. That is, it is our conscious thought to our level of development at the time that we are formulating the theory. And the diagnostic manual takes these theories and studies them statistically. But the one statistic that it really doesn't examine, the one research that it doesn't really delve into, is how our personalities form at the earliest time in our development. So if you ask me, I would say that if the diagnostic manual is to increase its efficacy, it actually might want to start studying, investigating childhood at the earliest point in our development, rather than what it currently does is to refine the statistical methods of approaching data. Of course, it is highly problematic to tell a parent, someone who is cradling an infant in their lap or in their arms, to suddenly fill out questionnaires about the infant's performance so that we can begin to evaluate the evolution of personality as we know it. And yet, if the limbic system is the first to develop and the earliest form of thinking, this is exactly what we should do if we want to really evaluate the evolution of personality disorder and of other mental illnesses. We need to look more broadly and in depth. I suppose we could say that all babies look remarkably similar and may be identical in many respects. But what we don't look at is the differences and how stimuli affect them over time and the intensity of the stimuli that they are responding to. Why did my brother at 7 years old, for example, decide that I was someone worth killing? What was it about him? What was it about me that he found so incredibly offensive, that he had to take action to do something. What was the underlying motive? It would be easy to simply say it came from coincidence, and a lot of people do believe that most or all of our experiences are coincidental in nature. On the other hand, as amateur scientists, which most of us are, we try to look at cause and effect because we want a causal explanation. Otherwise, why would we engage in diagnosis in the first place? Why did my claimant from years ago believe that she suffered from borderline personality disorder when she herself admitted that there was no trauma in childhood that she was aware of, but that she simply came out that way? Are we to accept this as fact, or do what we do in other areas of science, which is to say investigate? But in this case, we would need a population of infants that we can follow in life to see what kind of experiences cause them stress and that might cause them anxiety or anger to result in them acting out in later life. This is an undertaking that would tell us far more about human nature and our overall development, and may lead towards an explanation of what a personality is in the first place, because it was in these formative years that we diverge and start to become the individuals that are expressed in later life, around 24 or 26 years old, when the cortex is fully developed. I would suggest that personality is only partially a product of who we think we are, but not as much as who we perceive ourselves to be instinctively as our personalities evolve from our earliest years. And with this, we can become more sophisticated about how to treat personality disorders and other mental health diagnoses. I'm going to stop here and wish you all the best of health, but don't go crazy, as I always do, because there's plenty around to be crazy about if you really don't have some self-possession, which is something that evolves between the limbic system and the gray matter, in my opinion.